Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomason, Swanson, and Zahn Attorneys at Law.
Hi, I'm Dr. Gothenburg Chiropractic Clinic in Pelican Rapids, and more recently I've seen patients that have been coming in with the diagnosis of plantar fasciitis, if you've ever heard that word, or they're complaining of pain on the instep or heel pain. So I'm going to explain to you just a little bit about what we do with this particular problem, but as a matter of introducing the subject, the plantar fascia is it's a fascial band that extends from the heel to the forefoot. And the best way I've learned to describe this, for those of you who have ever done anything in the kitchen, think of this like the silver skin. It's that white sheath that's attached to a cut of meat that, in a sense, it's melded to it. In other words, if you try to pull it away, it's attached in effect to the muscle. And so this presents a problem when there's been an injury or microscopic or trauma to the plantar fascia. It affects both the fascia and the muscle attachment. So primarily what a symptom is that people wake in the morning with foot pain, and it takes several steps or longer before the foot, in a sense, loosens. And this is because at night the fascia shortens. So when you take that first step in the morning and you have to lengthen a taut or tight tissue, it causes pain. What do we do? As far as treatment, we use a technique that is not unique to chiropractic, and the acronym is ART, A-R-T, or active release technique. And in this particular case, if we find an adhesion or a tightness or a tautness anywhere along this fascia, I, in this case, would hold firm pressure toward her heel, and I would use her forefoot to bring that fascia into stretch. And so we may start working here, and we may follow that tight fascial band all the way to the heel. The treatment takes about 10 to 12 minutes until we get that tautness to feel very soft and receptive to pressure. When we're done with that particular technique, what we usually like to do is to tape the heel, and in this case we're using a kineso tape that attaches very well. We'll have the patient then hold their foot forward, and we'll have them hold that in position, and you'll see now I'm able to add a stretch to the tape. So we'll bring the tape into stretch and then attach it to the forefoot. And we'll ask the patient to wear this for 2 or 3 days. At the same time, we give them specific information as to stretches that we want to do, we want them to do at home. But this, in a sense, protects that fascial area. This technique is done about every 3 to 4 days. We have to give the body some time to heal or repair between treatments. The second thing I want to just touch briefly on is when people come in and they start complaining of pain over the forefoot, or they might even sense a shock-like pain into the second, third, and fourth toe. This is usually caused by a neuroma right in the forefoot, and in this particular case we can see this person has put is bearing weight on the forefoot, which is not right. There's a callus here. This responds very effectively to the same procedure that we used here, although on a slightly different direction. And to make that treatment effective, we use a very simple, cost-effective pad called a metatarsal pad, and we'll place this right below the metatarsal heads, or at the base of the second, third, and fourth, so that when the person steps down, they distribute the weight away from the forefoot. And this usually helps resolve the problem relatively quickly. If you have questions about foot pain, or whether or not the treatment that you have is effective, or whether or not you need an orthotic to support your foot, you can contact us here in Pelican Rapids at any time. Thank you.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomas & Swanson & Zahn Attorneys at Law.